Here they come.
So it seems like folks are able to join right now. And so I guess we'll start with a little bit of an introduction. Good afternoon or good morning, depending on where you are, for those folks who might be joining from Hawaii. And welcome to the Nutrition Incentives 101 panel. I hope everyone's been enjoying the session so far today at the convening. This panel is an overview briefly of nutrition incentives, a little bit of history, and a little bit about how they work. And there's going to be a presentation followed by a question and answer session with three of us representing Fair Food Network, the Farmers Market Coalition, and the National Grocers Association Foundation. And so to start us off, I thought we would the three speakers will introduce ourselves, and I can go first. Hi, everyone. Noah Fulmer with Fair Food Network. I, for the past many years, have done everything from planning and running incentive programs at farmers markets and grocery stores, and produce prescription programs at farmers markets, and to helping others across the country in terms of the planning and implementation. And it's a pleasure to be here with you all today. So I guess I will turn it over to Dar to share a little bit next.
Hey everybody, I'm Darlene Wolnik. I'm the Training and Technical Assistance Director at Farmers Market Coalition. FMC leads the Farm Direct Technical Assistance team at the GusNIP NTA, the hub. So our partners are our Ecology Center and the Michigan Farmers Market Association, and we provide technical assistance, training, resource development to all grantees and their Farm Direct sites. My background includes running farmers markets in New Orleans, running incentive programs at those markets, to providing direct technical assistance to markets and networks over the last 20 years across the US. I'm thrilled to be here. Tim, go ahead.
Thanks, Dar. And good morning, good afternoon. I'm Tim O'Connor with the National Grocers Association Foundation. My background is I had a career at the Food and Nutrition Service, most of which was with the food stamp, now SNAP program. And one of the things that I think back fondly of was leading the team that transitioned food stamps out of paper and into electronics. Since leaving there, I've done some consulting, and it's been a great honor to work with the National Grocers Association folks to try to bring the world of nutrition incentives into the brick and mortar stores, and looking forward to working with all of you folks and trying to make that happen. So back to you, Noah.
Great. Thank you, Tim. Thank you, Dar. So we wanted to start today with a little bit of background on the concept of nutrition incentives, which really goes back a long while. It's not as new an idea as some of us who are really in the midst of GusNIP or FENI projects would necessarily think. And so I thought we would start with a quote from the USDA administrator of the food stamp pilot program in 1939. And obviously, or not obviously, but at that time, there was a country in the middle of the Great Depression. And as Milo Perkins said, we had a picture of a gorge with farm surpluses on one cliff and undernourished city folks with outstretched hands on the other. And we set to find out a practical way to build a bridge across that chasm. So since the inception of that program in 1939, there really has been this idea to try to figure out ways to create infrastructure and programs and funding to help Americans afford quality foods at the same time as helping farmers find markets for their foods, and to overall boost the local economy and national economy. And so in terms of how these programs have worked over the years, there's in a certain sense nothing new under the sun. The original food stamp program in 1939 was structured in a way where families that were experiencing economic hardship would purchase food stamp booklets with their own money and get a bonus amount of money to spend on additional farm surplus products. And so that was a program that lasted until 1943. But you'll see, for those of you who are running for example, farmers market programs today, that's structured in a way that is not that different than many of the token or script systems work at farmers markets under GusNIP. Food stamps were turned in a more permanent way, well, actually first with a pilot in 1961. And that pilot really started in 5 different geographies across the country, and in a couple of years grew to 40 counties. And so that was representing 22 states, but it wasn't a statewide initiative. And it was kind of, piece by piece, iterating and testing how this idea of food stamps could work on a larger scale. And the goal, again, was to supplement what families were currently spending on food in order to help families more obtain a nutritional diet at a lower price point, especially for families with limited resources. So with the expansion to all of those 22 states by 1964, there was really enough understanding underway and evaluation that was happening to advocate for the program to become permanent. And so as a result of the Food Stamp Act, states were each tasked with developing an implementation plan for the federal food stamp funding. And that grew incrementally year by year. It didn't start off where there was necessarily enough funding for all the need, but there was also enrollment processes and awareness building processes to make sure eligible recipients in each state were aware that there was a food stamp program. And that process was also streamlined by 1977 in a way where eligibility was made consistent across every single state. And some of the barriers that were seen as existing in terms of how food stamps was implemented state by state, some of those barriers were reduced. And around, a little bit before some of those national standards came out for food stamps, but after food stamps were underway, in 1972, WIC began, and it really, was structured as a food prescription pilot with coupons available for mothers and children under the age of 5 that were deemed low income and at nutritional risk, and they were assessed by health professionals in terms of making that prescription happen. So that pilot, grew again state by state to the point where a couple of years later there were programs in almost every state, and then the WIC program was made permanent in 1975. It wasn't until 2009 that fruits and vegetables were actually added as one of the prescribed food items. So that's another, it took a little while for produce to become part of the picture, but that prescription idea was there. In 1986, there was a novel pilot that began at some farmers markets in the state of Massachusetts. And it was under the direction of the Massachusetts Commissioner of Agriculture, Gus Schumacher, who wanted to test a coupon program that provided, produce dollars for low-income women and seniors, and also support farmers at the same time. That concept later informed federal funding for a 3-year and 10-state pilot program in 1988, which led to what is now the WIC Farmers Market Nutrition Program, which for a while was the only fruit and vegetable benefit to families participating in WIC. And it is widely available in most states, but not every state, and many tribes also participate. And then, if we look to Gus's time as he, went from Massachusetts Commissioner of Agriculture to becoming USDA Undersecretary, he was able to structure a similar expansion of the Farmers Market Nutrition Program coupon concept for low-income seniors, which continues today as well and is available in most states. So fast forward to 2005, and that was when we really saw the first food stamp incentive programs at farmers markets begin. It happened in New York City with the Department of Health funding fruit and vegetable bonuses for coupons, or for customers, paying using food stamp benefits at farmers markets in the city. As was referenced earlier this morning in the keynote, there was a privately funded farmers market initiative, similarly, that began in Maryland at a farmers market in 2007, and that was the first example of private funding being used for the incentives. But within that time period, within a couple of years, there were really so many programs that started popping up across the country, state by state. Usually it was at the city level or kind of the metropolitan area level, and most of those programs were using private funds, municipal funds, or state funds to get these kind of SNAP incentive, or at the time it was food stamp incentive programs off the ground. And And there began to be some statewide approaches where there was standardization across the different entities that were offering the incentives that took shape in some states a few years in as well. 2010 was when produce prescriptions were piloted at farmers markets for the first time, and it was using private funding, and there were health clinics in Massachusetts and Maine that worked with farmers markets hand in hand so that patients that were at risk of diabetes were getting fruit and vegetable vouchers to spend at those farmers markets, and evaluation was done in terms of the impacts on things like BMI. And that pilot also expanded within a year to be at a couple more clinics in a couple more states. And as we all know, it's continued to expand since then. So all of this kind of activity that was happening at the very local level across the country was also of interest to federal policymakers that were thinking about how to continue to improve the way that federal food assistance programs can meet those needs of supporting families in terms of nutritional diet, as well as supporting local farms, agriculture, the economy. And so Congress in 2008 in the Farm Bill put appropriations aside for a healthy incentives pilot, which was conducted with the state of Massachusetts in one county and was a randomized control study of the impact of financial incentives for produce with a subset of SNAP recipients in the county. And that was compared to SNAP households in the county that did not get enrolled in the pilot. So that was the first concerted USDA effort to fund incentives and to test them. At that point, well, and I should say that USDA pilot program was done at farmers markets, grocery stores, and kind of all types of retail, but it wasn't open enrollment to all SNAP participants. So there weren't really at that point any programs operating in brick and mortar grocery stores. And that wasn't not until 2013 when there were some pilots that got off the ground in Minnesota and also in Michigan to test out the same concept that was working in so many farmers markets in the retail setting where most SNAP dollars are spent. And 2014 came along, and that was, again, harnessing all of the information that was being gleaned from programs across the country, an opportunity to make the case for federal funding in a way that would reach beyond just a study of the impacts of incentives into actually trying out innovative programs in every corner of the country, maybe corners of the country where there hadn't been the ability to get together private philanthropy before, or there wasn't local or state funding to date. And so the 2014 Farm Bill provided $100 million over 5 years for SNAP matching programs, which led some places like New Mexico and to be able to get state funding appropriated as match for those federal FENI dollars, because part of the FENI program requirements was that every federal dollar needed a non-federal matching dollar. And so we saw over the course of really just a couple of years, more and more states providing matching funding in order to draw down the FENI and now GusNIP funds. And what we've seen in the course of that first Farm Bill funding of SNAP incentives, that FENI funded over 100 projects of all different shapes and sizes in almost every state in the country. And one other thing before we get to GusNIP is that a lot has also changed when it comes to the way that food and food assistance work in the country. As Tim mentioned, we've gone from paper food stamps in the span of the program to EBT card technology. Now there's online ordering. Food stamps is also now known as SNAP, the Supplemental Nutrition Assistance Program. There's also been huge changes in the nutrition and kind of dietary issues and availability and access in the country, and there's different conversations happening around, what nutritious food means and what the challenges are and barriers around that. The food economy, farming, and food retail also look very different than they did 80 years ago. And so, with this kind of trajectory that we've seen in food assistance programs over time and those kind of goals around families, farmers, and local economy, it makes total sense that we're thinking as a field right now around how we can improve the efficacy of federal funding for nutrition through programs like GusNIP. And so GusNIP in the current Farm Bill, to give some context for folks who don't know, is $250 million over the 5 years of the Farm Bill. It's considered a permanent program because it has enough funding in its last year that kind of puts it over a threshold where it doesn't need to be renegotiated in a way that would put it at risk, as some other programs are that have less funding. It's structured as competitive grants for SNAP incentive programs for produce prescription, and there's also funding for the Evaluation and Technical Assistance Center, which is what is putting on the convening today. Those grants for SNAP incentives and produce prescriptions are up, or I should say the SNAP incentive ones are up to 4 years, and they require one-to-one non-federal match. The produce prescription programs do not require a match. And the applicant pool that's eligible to apply for those grants are generally nonprofits and state and local agencies, though partnerships can be with for-profit entities or universities. And there's a yearly RFA process for the SNAP incentive and produce prescription program. And really the goal continues to kind of be very similar to what was discussed in 1939 about increasing the purchase of produce, and maybe not produce in 1939, but increasing, food buying power for nutritious foods, in this case by low-income SNAP enrolled participants. And there is a priority for local, regional, and culturally appropriate produce as part of a project. So in terms of the way that groups are accessing that funding and the different roles that different folks play. So the applicant agency, the nonprofit or public agency, is typically in a position of raising local match if it's a SNAP incentive program, applying for the GusNIP grant, doing the outreach to retailers or farmers markets, and also acting as the fiduciary, so making sure that the money that comes from USDA for the incentives is flowing to reimburse retailers, and also going through participants in the program in a way that's accountable and has controls. And then there's the reporting to USDA, to the NTAE, and any other funders that might be providing match. The retailers, are in a position where they sign a MOU that describes that they, are going to adhere to all of the SNAP and GusNIP rules. They are training their staff, obviously, to run the program and to be aware of and to be able to communicate it with customers. They're in a position where they have to set up their point of sale systems so that they can implement the program in whichever mechanism program is able to run in the store. And then they're responsible for making sure they're reporting sales and doing the kind of reimbursement process back to the nonprofit or public agency that's the actual GusNIP grantee. So in terms of the kind of what we have seen across the field as many of the challenges, and Dar and Tim can weigh in more in a moment too. There's challenges along the way in terms of the application process for the RFA is something that many interested groups need help with. There's often challenges these days around standardizing programs as they grow, as they go from being pilots to growing their reach. How do they make sure that there's consistency in terms of an approach for the sake of both lowering administrative costs, being more efficient, but also making it easier for SNAP participants, or in the case of the produce prescription programs, those enrolled, to really be able to access these programs in an easy way. Some of that is very much connected to technology for the point of sale systems and for record keeping and evaluation, where there's not a standardized technology system in place yet, but there's a lot of work towards more standardization in both the farm direct and on the retail grocery side. Another real problem is there's not enough funding in GusNIP for all of the potential demand. Not every application can be funded with the current budgets, and certainly GusNIP doesn't have enough funding to match a significant percentage of SNAP dollars that are being spent across the country. So there's definitely more room to grow. And one of the challenges that goes along with that is, in order to grow a GusNIP budget, you need to identify match. And that's something that becomes tricky as you find success in these programs. Making sure that you can keep match at a 1-to-1 ratio is definitely something that can hold some programs back from fully actualizing their reach. There's also issues when it comes to growing the local food supply chains, particularly to grocers. And then there's capacity of grocers and farmers markets to run these programs. And lastly, one of the other issue areas that definitely comes up across the field is making sure that the implementation of these programs, knowing dollars are limited, especially, are reaching those who might be in say hard to reach communities that would otherwise typically be left out of some of this funding. So making sure there's concerted efforts around equity. And so all of these issues are things that we work on a lot at the Nutrition Incentive Hub, and are excited to work with all of you as you have questions, growing pains, any of those things. This is kind of the bread and butter of the work that we do across the partners at the Nutrition Incentive Hub. And with that, I think that brings us to the question and answer section of the session, and I will take I think I can come off of the spotlight, and maybe we can bring Dar and Tim back. And I have not been able to follow the chat to know if there are questions there, but if you have questions, I think probably the easiest way is to put them in the chat, and we can see how to field them from there. I'm not sure. We could also do some sharing of the mic, but.
Yeah, no, I think that was great overview. I was taking lots of notes about what you were saying. And I think you highlighted the challenges. I think the challenges one, especially that screen, the challenges you put up were so clear. I think as we talk about Nutrition Incentives 101, that I think we really want people to think about is how do they access the learning that's gone before them? There have been a lot of pilots. There have been a lot of tests out there. Some of them work well, some of them have not. Some of them will work for certain types of outlets, some will not work for others. I think what we heard in some of the earlier sessions too is, one of the weird problems people have with the nutrition incentive programs is when it's so successful that you don't even know how to hold the growth. There's so many people coming to the market that there's a line of an hour to process the card. What are you going to do about that? So don't just design a program for failure, design it for success. Think about what might happen if you were so successful. You may need to increase the number of outlets you have, or you may need to think about the product development that your, that your vendors have in the market or the farm stand. In the chat screen, I put down some major steps that we see in a lot of these examples, these 101 resources. Some of the steps are really, the first thing is the partnerships. It's not the second or third or fourth. It's literally the first thing you need to think about is who's going to help you at every step. And this for us in the farm direct side of work, I think this is a real pain, point. Markets certainly have lots of partners, but to really design a program in step with other partners is not something a lot of farmers markets or farm stands or CSAs have done in the past. This requires a lot of planning before you do implementation. So really think about how those partners work. How do they work align with yours? Is there a season similar to the yours? Like we'll see farmers markets lining up with universities. That's great, but universities aren't necessarily active in the summer when so many farmers markets are. Are you going to have the team that you need for the summer? So things like that but I thought some of the things you highlighted were really, really, really helpful. Tim, what are your thoughts?
Well, first of all, I was going to say, I didn't know that Noah was going to go back that far in history. So the trivia question for him is, who was the first food stamp recipient, in what city and what store? But we can come back to that. And it was in 1939. Yeah, I think, some of the challenges I think that stores are looking at is when an incentive program is coming into a store, I think it's important to think about the context in which it's going to be operating. The incentive program is kind of an overlay. It's probably not going to be the major thing the store does. So a grantee is going to, in essence, compete for time from the store, not just the time to manage it and set it up, but also for resources. If the store is going to have to invest in technology or whatever in order to make it happen. And so it may be a different dynamic than it is perhaps with the farmers market, especially if you start to get into local sourcing. There was just a conversation about local sourcing in a session prior to this, and it's apparent that local sourcing comes up in two different ways. One is local sourcing used as a trigger for the customer? Can she only get an incentive if she's buying something that is locally sourced? Is it only used as something that you can use the incentive for? Or is it neither of those, and it's used to determine what the eligibility of the store is from the grantee's point of view? Do they have enough locally sourced produce? And it's not necessarily relevant to what the customer is going to buy. And I bring that up because it has implications for what the store is then going to be required to do. The kinds of changes that a store has to make at its front end to do any one of those three things, and sometimes it's combinations of those three, can be daunting. And it involves not just the store, it involves the technology the store has, it involves the technology provider the store has, and then you overlay that with other kinds of things like, are they in the middle of doing any other upgrades and that kind of stuff. So the point being is that I think as grantees look to stores as their partners, and those are outlets that can get to a lot of SNAP customers and provide the incentives to them, think about the context in which you're dealing with that store. And the store, very often, especially if it's a community-based store as opposed to a big chain, and this is not a knock on big chains at all because they can be great partners, but a smaller store may be more invested in the community, may be willing to be, well, may be more nimble and may be able to set aside some of these considerations because of their concerns for their customers and their community. So there's lots of different dynamics that come into play when you're dealing with stores. So
I think thank you, Tim and Dar. And I don't know if there are questions that folks have or thoughts, other kind of nutrition incentive guidance points that you think from your experience, if you've run programs, you found particularly helpful in getting a program off the ground or in many years of running a program. I'm happy to share the stage with others, or if folks have a question, and you would like to speak, that also, there's plenty of time for that.
Yeah, and I put in that, I put in the link into the SNAP guide that Farmers Market Coalition has put together some years back. I think in terms of 101, obviously that's something also really important to think about, which is what is the approach to SNAP? Again, in the Farm Direct cycle, there's a question about whether it's at a channel level or at the vendor level, direct marketing farmers. F&S allows both of those entities to become SNAP retailers, of course. And so we see in some cases where a farmer who has a farm stand or a CSA may be a direct, maybe a retailer themselves. There are some, of course, CSAs are doing SNAP and doing incentives as well. So there's a lot to be done, to be thought about in terms of how you approach this, including looking around your local food system and see what's already happening, see who's doing SNAP and how they're doing it and how they're doing incentives. And then also, I think it's also great I love this. One of the things I love about this work that we're doing right now is we're getting a chance to work directly with the National Grocers Association Foundation. We're learning from grocers. We're learning from experts like Tim about what is happening at the grocery level, which is not something that the two entities have done a lot of into this point at the national level. So that's exciting, is we're hearing about some of the pain points they have and that we have, and we're trying to solve some of those together. So that's like things like technology or the grant itself. So we definitely would like to know more about that as well. We'd like to know about how folks are doing that are doing both, that are doing Farm Direct and grocer as well, because of course as we're pointing out, they're very different from each other. The way that you have to go in and operationalize these programs in the grocer versus the farmers market or CSA or farm stand are very, very different. And it has a lot to do with those partners and those partners early on.
Yeah, and I can add, part of the magic of running a program in a way that really, is able to scale and grow and work well in the long term is about trying to figure out those implementation pieces in a variety of retail types in a way that doesn't or minimizes the impact or confusion for participants in the program. So it may feel and is truly different in terms of what is happening at the cash registers in the store versus at the farmer's market, but figuring out ways so that customers, no matter where they are, understand, the similarities across the program in the case of the many programs that are out there that are in fact operating not just in one or the other. And so I think as the field grows and as projects, kind of expand their reach, that is one of the questions, and kind of comes down to often some of the communications and branding and marketing work that can be done, as well as training work at the various sites. So that's something that maybe isn't always anticipated in the beginning, where you're like, how do I make this work at this particular farmer's market or at this particular store? But then as it gets more complicated with more sites, it definitely helps for the GusNIP grantee to be holding kind of that perspective of like, how do I make this as positive and easy a program as possible for those folks participating in SNAP who can also take advantage.
Yeah, and thanks. And I think one of the things I always like to point out to people is that, the modern farmers market movement, 1970 on, let's say, markets growing in number, mission-driven farmers markets happening all over the country. Some are about economic development, some are about ecological stewardship, some are about, reducing some of the divides between the people in their communities, some are all of those things. But in essence, the way we like to think about in the modern era is that farmers markets incentivize behavior change through all of the things they do. The idea of having the appealing, lovely space in non-pandemic times with seating and time for talking among different groups, or having a connection directly to the growers that you can actually help to affect the way they grow, or vice versa. The idea is incentivizing the actual change for everybody who uses the market. And so we like to help also farmers markets that are thinking about nutrition incentives to think in those terms across all of the work they do. That how are you incentivizing the behavior change at the market, not just for people who are using benefit programs, but for everybody who's entering the market. How does that change? And so that also may be helpful for people that are thinking about how they're going to pull this program into their work they do, and to think of that really, that's the kind of the work of the farmers market and the farm direct field altogether in the last 30 or 40 years, I think.
One of the things I think is important for folks to keep in mind as they're designing programs and thinking about things is that if you look at what is happening in the store with a SNAP EBT transaction, SNAP does not know what somebody's buying. That transaction that's happening doesn't identify the individual items that anybody's purchasing. It kind of gets totaled up and it's just processed as a financial transaction. When you get into the world of incentives, you then need to try to figure out, well, technologically, how am I going to figure out which items are eligible for the incentive? Or what can I use my incentive? What items can I use that incentive on? It's a change to the technology, and it's a tricky one. And it also is a change that gets done in a context of the sort of the opposite of incentives, where Dar, you were just talking about incentivizing behavioral change. In part, the idea of incentives came to the fore because there was an effort to try to restrict what people could buy with SNAP. And so rather than restrict what they can buy, let's incentivize and provide them with an extra benefit to try to change their behavior in a positive way. As the technology advances to make incentives work, you start to go back the other way and perhaps make restrictions a little bit more tenable. So there's a balance that has to be struck as well. That's sort of the public policy side, not necessarily the grocer side. But on the grocer side, to make these things happen in a seamless way, there needs to be an investment and some technology changes. And it has to be kind of across the board. And that's one of the things that we at NGAF are trying to deal with, which is identifying what are the standards that ought to be in place so that it is worth it for point of sale companies to make the kinds of investments in their technology that would allow incentives to go forward. And the incentives, the technology that we would be putting in place for GusNIP is not just for GusNIP. It's for produce prescription, whether it's GusNIP funded or not. It's for the dairy incentive programs. It's the same kind of changes that are coming down the road. So it's kind of a mishmash, but there's technology issues, there's public policy issues, all that come to the fore here, and there's a balance that needs to be struck.
So there's two questions I see in the chat. One of them is about the history of nutrition incentive programs in the US, also perhaps being expanded to include what we can learn from other countries, similar attempts at funding nutrition, and like if there are different shapes of things we can learn from. And the truth is I am not super familiar with examples of programs in other countries other than I know that we have often been asked about how to expand or for advice around expanding things like nutrition incentives to Canada is one example where because I think of our proximity, we get a number of requests regularly about that. But there are other countries as well. And one of the interesting things about the policy here in the US is that there has been the specific stipend for food through the SNAP program that is not necessarily the approach that other countries have taken. So in Canada, for example, there are cash benefits that are made available to families with certain, low-income eligibility and other criteria. That is the main form of federal benefits in Canada, as opposed to having a food-specific program. So it's trickier to add a produce incentive onto a general cash benefits program. And so I think there are those kinds of constraints where I don't think we're probably unique in having the food benefits side, but there are many countries that haven't bifurcated their funding streams, or we have a separate cash benefits program from our food benefits here. So it would be interesting to dig into more. I think the other question that was there is about, talking points for approaching stores or other partners to try to get them interested in joining an incentive program. And there's a couple of.
Let me answer that quickly before I turn over to Tim, because it was just about partners altogether. And I think one of the main things here is finding out the measures of what you would consider success that match, right? That's really the big thing. Like, what are you looking for in terms of, you want to add SNAP shoppers to your market? How does that fit into what those partners need? So finding measures of success that you share is the most important thing. And there's a lot of those, and I'm sure many of the materials will talk about that, but I'd love to hear what Tim's sense is about how do you approach grocers about creating partnerships.
Dar, do you think I have the magic answer to all of this stuff? Oh,
yes.
I think I've been set up, folks. So, it really is situational at this point in terms of how do you match up a grantee to a potential grocer partner. One of the things that we describe our work as is sort of a match.com for this arena. Let's try to match up a grocer with a grantee, and we find ourselves talking to grantees looking for grocers and grocers looking for grantees. So I suggest that, I'm not just trying to cause you to try to get in touch with us, but do get in touch with us, because we do need to understand what a grantee is trying to accomplish. And then we have contacts, and we can reach out to local communities and stores and stuff that we know of and try to find whether or not there is a grocer that can be matched to it. And it's a matter of, as I was saying before, what is the situation with the grocer? What are their characteristics? How attuned are they to the community? What is their technical platform? Those kinds of things. And we can work with both sides to try to bring them together. And in the course of doing that, try to get both sides to understand what the other side's trying to accomplish. So the grantee can understand the context of how the store is operating, but the store can understand what is the grantee trying to accomplish at the same time. The bottom line being, it's the SNAP customer that we're all trying to reach and to try to improve their buying habits and their buying behaviors and stuff. I'm not sure I answered that, but
I think that was pretty good. Yeah, and I think it's a really good point to think about. Again, what are they trying to achieve? For a lot of these grantees, there's a lot of partnerships in public health, of course. This has been the big shift in the world that we work in over the last 10 years. You've heard a lot today about the emergence of the incentives and SNAP programs at markets, circa 2000 and 2010. That's really when we started to have partnerships with public health entities, really diving deeply into the work we're doing. And so there's a lot of those partners, but there's also city partners and retail partners and lots of other partners to think about. And as Tim is pointing out, technology is still the big concern, as Noah also pointed out. So that's something that's a problem. And it's a great thing to work on with partners, is we don't have the technology to do what we want to do. Let's see if we can find, so those partners might be developers or software people or others. It doesn't just have to be the funders and public health entities. There are lots of ways to think about partners.
We have put together some information that we've got on the website about, how to match up grantees and stores. We kind of think about it as, how do you make the stars align? And there are just so many things that can happen. We were dealing with one store who was very interested in getting involved with a grantee until the hurricane knocked him out for about 2 or 3 months. And it's sort of like, well, the wind went right out of the sails on that one. So, the stars need to align between the grantee and the store and that kind of stuff. So we can help try to make that happen. There's a session tomorrow to talk about some of those dynamics and things. So if that's something that you're particularly interested in, you may want to look at that session as well.
There's one more question that I see in the chat about if there's any efforts coming up in the next Farm Bill to include language around equity with regards to the retailers included in incentive programs and technological upgrades. My initial reaction is actually we don't need to wait for the next Farm Bill, that there's funding through the NTAE, through the Nutrition Incentive Hub and partners to be able to advance technology solutions in a way that is making them lower cost and more accessible to a wider variety of retailers. And so I would say, if that's something you're interested in, Tim, I apologize. Ted is also at NGAF. And so I don't know if Tim is the right contact for it, but there's a whole team of folks at NGAF really thinking about the technology questions right now and how to make it accessible to more retailers. So now's a great time to join some of those conversations. I think, as many folks at the table as possible to make sure that the solutions that come out are really ones that will work for your retailers and a wider variety of retailers.
Yeah, and in the near future, I think folks who are interested in this arena will be hearing from us, because it really takes both sides. There needs to be some commonality on the grantee side about what it is they want to see happen at the point of sale. Once that comes together, then it's easier to go to the technology industry and say, build it once, don't build it 100 times. There is some funding available, but if we have to fund every store, that funding doesn't go very far. If we have to fund every company, that's not going to go very far. But if what we can do is foster a single set of functionality and then match it up and say, industry, go ahead and build it, then we get a more universal application and solution at the point of sale. And that's where we're trying to edge to at this point.
Yeah, and it sounds like I maybe misunderstood part of the question as to whether GusNIP itself would prioritize certain retailers based on like equity as a criteria. And I think, those conversations around the GusNIP and the next Farm Bill are starting, and definitely there are ways through the hub again to contribute feedback about what's working well about GusNIP right now and what's really not working well. So I would send comments that you have through whether the Slack channels around, if it's corner stores or other types of retail. So again, we can kind of incorporate feedback and have as much kind of understanding of where the program is not meeting the needs of folks across the country as possible going into the conversations around the actual policy for the next Farm Bill round. So I think with that, we have reached the 4 o'clock hour, and we're up. Maybe there's a
I have the answer to the trivia questions.
Oh
Oh,
gosh,
yes, thank you.
was it West Virginia? I'm going to guess West Virginia.
West Virginia was the first state in 1961.
Oh,
In
okay.
1939, it was Rochester, New York. The customer was Mabel McFiggin, and she used her benefits in Joseph Mutolo's store.
I'm gonna write that down for next time.
We should have started with a
He's gonna
trivia
ask that
question.
again. He's gonna ask that again, y'all. Keep that.
There will be a test.
Thank you all. That was great. Enjoyed.
Thanks, everyone. And if you do have any questions that we weren't able to answer that come up later, whatever it is, feel free to email ta@nutritionincentivehub.org, and we will route it to the right folks who know the answer.
Right.
And that includes any comments about how GusNIP can be made better. So thank you.
Thanks, y'all. Good luck.
Thank you.
Take care, everyone.